At the beginning of December 2023, the IV room at Beijing Children's Hospital was overcrowded.
I never really expected this. We hadn't left home for more than a month, and the child still caught a fever. There was no warning. We came to the hospital at 7 a.m., and it was more heartbreaking here than you can imagine. At this time, the number of the waiting list had already reached beyond 500, and there was a long line at the check-in window 24 hours a day, and there was basically no break in the crying of children during the lab tests.
On December 4th, China's National Health Commission issued a notice stating that every possible means will be used to tap resources for pediatric diagnosis and treatment services and to divert children to primary healthcare institutions for first and second visits. Primary healthcare organizations in all regions should be fully open to children and should not refuse treatment. This notice exposes the severity of the current epidemic and the embarrassing dilemma that's beyond the CCP's ability to handle. Large hospitals are now unable to service the massive number of children seeking treatment and must be triaged to the grassroots level. This is typical of the CCP by way of an executive order, requiring the grassroots medical organs to cooperate and pushing the pressure of the epidemic downward. In other words, it's dumping the problem on the grassroots. This is the Beijing Children's Hospital. It's like this every day, overcrowded. The notice said that the epidemic periods of respiratory diseases in winter in many parts of China were overlapping, and it was necessary to guide the key groups of people who met the conditions for vaccination to receive vaccines against influenza, new coronavirus, pneumonia, and other vaccines. The Beijing government has gone to great lengths to avoid terms like coronavirus and plague, but the death of a known actress has made the entire country to start digging. Is it the new coronavirus that took her away? Hong Kong star Kathy Chow shifted her career to mainland China in recent years. She was rumored to have passed away on December 11, 2023. The news quickly hit the Weibo hot search. At almost the same time, it quickly spread among overseas Chinese communities too. This actress passed out suddenly on the afternoon of December 11th in her own villa in Beijing. The staff called the emergency services. The tipster described she was found to be gone with no vital signs upon arriving at the hospital. On December 12th, her studio confirmed that she passed away on December 11th due to ineffective medical treatment. Kathy Chow was born on December 6, 1966, in Hong Kong. She played a role in a TV series named The Heaven Sword and Dragon Saber. It was based on a martial arts novel named Condor Trilogy. The Condor Trilogy has a profound impact on a generation of Chinese, and Kathy Chow was nicknamed the most beautiful Zhou Ji-ro for her role in the play. It was one of the most iconic in her acting career and made her very popular in Taiwan and China. Such a beautiful actress shocked the Chinese public with her sudden death. It occurred in Beijing, where the epidemic is suspected to be serious, which has inevitably made people wonder. According to one theory, the new coronavirus is deeply related to the Chinese Communist Party, or CCP, which is why some overseas media have dubbed it the CCP virus. We won't comment on the theory. It is only true that a large number of loyal CCP members, including many prominent figures, passed away during the epidemic. In August 2019, during Hong Kong's anti-extradition bill movement, after Jackie Chan and other celebrities made short films in support of the CCP, a CCTV campaign, which was dubbed Relay to Protect Hong Kong, featured Kathy Chow, who published a film on Weibo to show her support. She said, "The situation in Hong Kong has touched people's hearts. No matter what, Hong Kong can't afford to be in chaos anymore. I was born, grew up, and worked in Hong Kong. China is my motherland. Hong Kong is my home. I love China. I love my home. I hope that Hong Kong will restore peace, calm, and harmony soon." As news of her passing hit the Weibo hot search list several times, her high-profile showcase of getting vaccines during the outbreak, as well as her short film of love for the country and the party in support of the CCP, were also rehashed by the netizens.
大家好，我是周海媚，感谢西瓜视频。Hello everyone, I'm Zhou Haimei. Thank you for inviting me to participating in the event. With honor, my highlight moments with the motherland. In the centenary year of the founding of the party, there have been many high moments for the motherland, and the one that had the greatest impact on me was the fight against the new coronavirus outbreak in 2020. I feel proud of my country's work in preventing and controlling the new coronavirus epidemic and developing the vaccine for it. At the beginning of 2020, the global outbreak of the new coronavirus epidemic had a great impact on my life and work. I minimized my work travel. I turned down 3 productions in the last year because when the crew shoots a movie, the makeup artist can wear a mask, but the artist can't. The crews all congregate together. At the beginning of this year, there was also an outbreak in the community where I live. And at that time, I had to go for a nucleic acid test every week, and access to the neighborhood was also very strict. The epidemic prevention work in Beijing reassured me and made me feel safe. At the beginning of the epidemic, I thought, as a public figure, what can I do for the prevention and control of the epidemic? Later, I was invited by the government to shoot public service posters, which were broadcasted on the subway, buses, and outdoor screens. I was also invited by today's headline to become an epidemic prevention and publicity officer to shoot videos on how to correctly wear masks, how to disinfect, and keep a family diary to educate the public about the disease. At the beginning of April, I was especially happy to see the news about the vaccination plan for Hong Kong and Macau residents. I made an appointment for the vaccination as soon as I finished my work. Before the Spring Festival, my staff and the nanny at home went to get vaccinated, and I was envious. Also, due to the epidemic, I haven't been back to Hong Kong for 2 years, and now I have completed 2 doses of the vaccines and feel much relieved. I'm very proud of the vaccine developed by the motherland, and there is no need to wait for a long time to buy vaccines from other countries. In Beijing, all my friends around me have been vaccinated, and my friends in Hong Kong have also been vaccinated with the domestic vaccines. I'm very proud to protect myself and others, as well as contributing to the prevention of epidemics. I hope the future of the motherland will be better, and I have my part to play in the development of the motherland.
Against the backdrop of national inquiry by the public, Kathy Chow's medical records were also leaked and circulated online. According to a staff member of the local hospital, the circulated medical records were authentic. On December 13th, the CCP's official media outlet, the Beijing News, reported that it had been informed by a source close to the hospital that 2 people implicated in the leakage of the medical records had been identified and handed over to the police. Various Chinese media reported that in the section of the past medical history of her medical records, one of the items was systemic lupus erythematosus, or SLE. As a matter of fact, Kathy Chow was rumored to suffer from SLE since 1998 and had to take a break from work to recuperate. At one point, she almost disappeared from the Hong Kong entertainment industry. In recent years, she moved to the mainland. In 2021, she posted a video on her social media platform of her getting a new vaccine in Beijing.
大家好，我是周海媚。
Hello everyone, I'm Zhou Haimei. Today I can finally go to get the new coronavirus vaccine. Finally, I can get the vaccine. In early April, I saw the news that Hong Kong and Macau residents can get the vaccination, so I made an appointment right after I finished my work. At the beginning of last year, when there was an outbreak of the new coronavirus, I minimized my work and canceled 3 plays in one breath. At the beginning of this year, the Shunyi district outbreak was up again, but I'm very confident in Beijing's epidemic prevention work. Before the Spring Festival, my staff and the nanny went to get vaccinated. I was envious. Now I can finally go to get vaccinated too. Although the national outbreak is now under control and relatively stable, there are many parts of the world where the new coronavirus is still prevalent, and vaccination is the best way to guard against a resurgence of the new coronavirus. I followed the instructions and brought my Hong Kong and Macau travel permit, health insurance card, and residence permit. I came over to line up.
港澳通行证、医保卡、居住证过来排队了。你好。
Hello?
Any discomfort lately?
No. Yes, I live in Shunyi district. Where do I go now?
Go straight ahead.
Hello? If you feel any discomfort, we have doctors and nurses downstairs, so you can just call them anytime. Okay.
Come for your second vaccination after May 17th.
Okay, thank you. Cotton swabs can be taken away, so just leave them here.
是不能带走的，就扔在这里就行了。
Now I'm done with the vaccine. I'm going downstairs and will stay there for 30 minutes for observation.
留观30分钟。
I'm going to come back here in 3 weeks for a second shot. I'm going to finish the second shot in order to complete the entire vaccination process.
It is said that a netizen left a comment at the time for her. Sister Chow, don't you have an immune system disorder? Can you receive the new coronavirus vaccine? She replied, "Thank you, I'm not sick. Please don't believe the rumors." Data shows that SLE is a chronic autoimmune disease in which all organs of the body can be damaged. The patient's immune system is impaired. The new coronavirus also specializes in destroying the immune system. Inactivated vaccines are said to reduce the autoimmune system in the short term, which is what SLE does. The combined effect of the two is a dramatic reduction in the body's ability to protect itself. On the medical records circulated online, the doctor's diagnosis showed that Chow was suspected to have been infected with the new coronavirus. The symptoms of coughing and wheezing that this actress presented were similar to the recent so-called mycoplasma pneumonia. The hemorrhagic spot with a diameter of 8 millimeters under the conjunctiva of her eye was the same as the typical symptom of infection with Omicron XBB 1.16, a variant of the new coronavirus. The truth about the actress's death may be covered up by the Beijing government for a long time. Either way, the news at least puts China's domestic vaccine in a bad light. During the previous 3 years of the epidemic, the CCP refused help from the West and administered domestic vaccines to nearly all of the population. Although the Chinese government insists that the current surge is a cold-like respiratory illness, more and more people are suspecting it's a return of the epidemic. On December 10, 2023, the Chinese Disease Control released guidelines for wearing masks, 2023 edition, making the public even more skeptical. Some people commented, "Aren't the next steps to lock down and do nucleic acid tests?" Actually, it has already started. On December 2nd, a Chinese professor released a video saying that he was asked to perform a nucleic acid test while attending the 2023 Understanding China International Conference in Guangzhou. I arrived in Guangzhou for the Understanding China International Conference and just completed the registration process. The first thing I had to do to attend the conference was to take the nucleic acid test. I was told that the results would be out in the afternoon, so I hope everything is fine and I can attend the conference without any problems. The video has received tens of thousands of views. The familiar scene of taking nucleic acid tests has triggered heated debates among Chinese. Some exclaimed, "How come nucleic acid tests are still being done? They still require nucleic acid tests now? What is Guangzhou doing? I thought I misread the posting time." An important international conference has restarted nucleic acid testing. What does it mean? The name of the conference is Understanding China. Do you think the international participants have understood it? On December 1st, He Xiaopeng, chairman of Xiaopeng Automobile, tweeted that he returned to China from overseas via Shanghai. As soon as he got off the plane, he was asked to test for nucleic acid, and he was jabbed by 2 swabs at a time. The official response said it was a spot check, but everyone was tested. The tweet has now been deleted. In addition to the familiar scene of nucleic acid testing, health codes are also said to be making a comeback in parts of China. Some residents in Guangdong and Sichuan reported that since December 1st, the health code was back online. Some people showed the green code of Sichuan Tianfu Health Pass. In addition, new vaccines made in mainland China have been added to the list. On December 7th, Chinese media reported that a vaccine against XBB variant of the COVID-19 virus had been officially released to the market. From December 1st to 3rd, new coronavirus vaccines from 5 Chinese companies were incorporated for use in an emergency. As seen in the last video by our channel concerning the new wave of epidemic, Fangsong Mobile Hospital's Dabai anti-epidemic personnel in white jumpsuits, nucleic acid tests, vaccines, health codes, masks, and other elements of the epidemic have all come back one after the other. They have made Chinese people seriously wonder about the severity of the new wave of the epidemic. Judging from the current state of affairs, the largest group of victims of this outbreak are children. The authorities in Beijing consider it normal. China has a very sound healthcare system, and there have been some cases of children being infected in certain parts of the country, which would actually happen in any country, but in China it is under effective control. Rhetoric like this can't help but bring to mind how the CCP downplayed the outbreak and banned whistleblowers at the very beginning of 2020.
On January 1st, Wuhan police made an announcement. 8 people were punished for spreading rumors about an unknown pneumonia. 8 people were punished for spreading rumors. 8 people were punished for spreading rumors.
8 people were punished for spreading rumors.
8 people were punished for spreading rumors. 8 people were punished for spreading rumors.
At the same time, the police prompted, outside the law doesn't mean it's a place of lawlessness. Online speech should comply with laws and regulations. For the fabrication, spreading, and dissemination of rumors disturbing the social order and other violations, the police will investigate and deal with them according to law and will not be tolerated.